Hello and welcome. Look, if you or maybe someone you love just got a BPH diagnosis, you probably have a million questions running through your head, and that's totally normal. So, we're going to walk through this together, get you some clear, simple answers, and hopefully a lot of peace of mind. Let's get right into it.
Okay, let's start with the big one, the absolute #1 thing I want you to hear today. Right off the bat, BPH is not prostate cancer. The B in BPH stands for benign, and that's just the medical term for non-cancerous. It's super common, and it does not mean you're more likely to get prostate cancer down the road. So let's all just take a deep breath on that one.
All right, so with that out of the way, let's get down to basics. What exactly is BPH? Well, to get it, we've got to talk about the prostate gland itself, what it is, and what happens to it as we get older. Here it is in plain English. Benign, not cancer. Prostatic has to do with the prostate. And hyperplasia, that's just a fancy word for enlargement. So, all it is a non-cancerous enlargement of the prostate gland. And for a whole lot of men, it's just a natural part of aging. Now, to really understand what's going on inside your body, I want you to forget all the medical jargon for a second. We're going to use a really simple analogy. Just picture a regular old garden hose. So the tube that urine travels through to leave your body, that's called the urethra. It runs right through the center of your prostate. When everything's normal, it's like a brand new, wide-open hose. Water flows through, no problem. But as the prostate gets bigger with BPH, it starts to squeeze that tube. It's literally like stepping on the hose or putting a kink in it. And right there, that's the perfect picture of why the flow slows down. Now that kink in the hose is what causes all the symptoms you might be dealing with. So let's talk about what those feel like. They usually fall into two different buckets, and figuring out which ones you're experiencing is really the first step to feeling better.
So on one hand, you have what we call obstructive symptoms. These are your flow problems caused directly by that squeeze. You know, trouble getting the stream started, what doctors call hesitancy. Or maybe the stream is just weak, or you feel like you're not quite done even when you are. Then, on the other hand, you have irritative symptoms. This is your bladder getting, well, irritated by the whole situation. That's when you get that sudden gotta go now feeling, or you're just running to the bathroom all the time. And yes, this includes waking up at night to go, which has a name, nocturia.
So you're nodding along thinking, yep, that sounds familiar. So what happens next? Well, the journey to a diagnosis is actually really straightforward. Your doctor has a few simple tests to confirm it's BPH and, just as important, to make sure it's not something else. Your doctor's toolkit is pretty simple, and each tool answers a different question. The DRE is a quick physical exam to check the prostate's size and feel. The PSA blood test is there to rule out cancer and give you that peace of mind. Uroflowmetry is actually kind of cool. You just pee into a special machine that measures your flow rate. It's a direct way to see how kinked that hose is. And finally, the PVR is just a quick, painless ultrasound on your belly after you go to see if your bladder is emptying all the way. It's all very low-key. Okay, so you've got the diagnosis. Now the conversation changes. We start talking about treatment. And the whole point of treatment isn't just to fix a medical issue. It's to improve your quality of life. It's about getting you back to living your day without planning it around bathroom breaks. For most guys, the first stop on the road to relief is medication. There are a few different types, and each one comes at the problem from a slightly different angle. Let's go right back to our garden hose. Alpha blockers are often the first thing doctors try. They don't actually shrink the prostate, instead they relax the muscles around it. It's kind of like gently taking your foot off the hose to let the water flow better. It loosens the kink. Now, 5-alpha reductase inhibitors are different. Their job is to actually shrink the prostate gland over time, which, you guessed it, reduces the size of the kink itself. Now, this is super important for setting expectations. With alpha blockers, you can feel a difference pretty fast, sometimes in just a few days as those muscles relax. But the 5-alpha reductase inhibitors, they're more of a long game. Because they're physically making the prostate smaller, you're looking at several months before you really feel the full effect. So, a little patience needed there. And then there's tadalafil. This is a pretty interesting option for men who are dealing with both BPH symptoms and erectile dysfunction, or ED. It's one pill that can help with both issues at the same time, which, for many guys, is a huge win for their quality of life.
So what happens when you've tried the medications, but you're still not getting the relief you need? You know, you're still getting up 3 times a night, and it's really starting to wear on you. Well, that's when you and your doctor might start talking about some other options.
When it comes to procedures, there are a few choices, but two you'll hear about a lot are UroLift, which is a really minimally invasive approach,
and TURP, which has been the gold standard surgical solution for a long, long time.
So here's the difference in a nutshell. UroLift is pretty clever. It doesn't actually cut or remove any tissue. Instead, a doctor places these tiny little implants that act like tiebacks for a curtain. They just pull the prostate tissue aside to open up the channel. TURP, on the other hand, is more direct. A surgeon goes in and carefully removes the excess tissue that's causing the blockage, basically carving out a wider tunnel for the urine to flow through.
And no matter what treatment you end up with, there are things you can do every single day to feel more in control. These are simple habits, but they can make a surprising amount of difference.
Here are 3 things you could literally start doing tonight. First, try the double void. Sounds complicated, but it's not. After you think you're finished, just wait 30 seconds or so and then try to go again. You might be surprised what comes out. It helps make sure the bladder is really empty. Second, be smart about when you drink. Try to limit fluids, especially caffeine and alcohol, for about 2 hours before you hit the sack. This can be a game changer for waking up at night. And lastly, a heads up, some common over-the-counter cold and allergy meds can actually make BPH symptoms worse, so just be aware of that.
And that's really what this all boils down to. This isn't usually an emergency. BPH is something that happens slowly, over years. The whole goal is just to find the option that helps you feel better and live your life more comfortably. You've got time, and you've got a lot of really good options.
So, we've gone from garden hoses to medications to daily habits. We've covered a lot. But what's the one thing, the most important idea to walk away with?
It's this. Getting a BPH diagnosis isn't a crisis. It's the start of a conversation. It's the beginning of a partnership with your doctor to manage a really common and really treatable condition. It's all about getting you back in control. Thanks so much for your time today.